Hi, it's Dr. Elisha Van Dusen with New Hope Chiropractic. What are some non-surgical ways you can deal with bone spurs? Well, this is something we're going to delve into a little bit today. Bone spurs, also known as osteophytes, are bony outgrowths that form along joints and the edges of bones. And treatment options include medications like anti-inflammatories and corticosteroids, physical therapy, also chiropractic care. Bone spurs typically occur when there's an excess stress in a joint or tendon, when ligaments or tendons become inflamed due to arthritis or other bone joint-related conditions that can cause wearing away of the cartilage. Bone spurs don't always require treatment. Depending on the severity of the condition and the location, a lot of bone spurs may go away on their own. If a person has mild bone spurs and no symptoms, they may be able to manage the condition without any kind of intervention. However, if the bone spur is causing pain, immobility, or other symptoms, it may need to be treated. So bone spurs can develop on the heel and the foot. Those are probably the most common. Shoulder, neck, low back, hands, knees, and wrists. They typically are classified according to the location in the body. The most common bone spurs, of course, are heel spurs, which develop on the underside of the heels, and shoulder impingement syndrome, which affects soft tissues in and around the shoulder joint. Lumbar bone spurs are bony outgrowths that form along the edges of normal bones in the spine. They can lead to pain and limited movement if they press on a nerve or the spinal cord itself. Bone spurs can develop as a result of aging-related changes in the spine, like degenerative disc disease, arthritis, or trauma to the bones of the spine. Lumbar bone spurs are usually diagnosed with imaging like X-rays, CT scans, or even MRIs. These tests can help doctors determine whether a bone spur is pressing on a nerve root or causing symptoms. Treatment options for bone spurs include pain medications, exercises to strengthen the spine and reduce stress, things like physical therapy, in some cases surgery in very severe cases. And neck bone spurs are small, bony projections that form along the edges of the cervical vertebrae. They develop when the body produces extra calcium in response to damaged joint surfaces. Neck bone spurs cause various symptoms like pain, tenderness, and restricted mobility. In some cases, neck bone spurs can also lead to nerve compression, which can cause numbness, tingling, and weakness in your arms. And treatment can offer some of the options that I just described to you. Heel bone spurs are small, bony projections that develop along the edges of the heel bone. They can be sharp, they can protrude into nearby tissue, leading to pain and discomfort. Usually this happens because of long-term stress on the foot muscles and ligaments, which pull on the heel bone with excessive force, causing calcium deposits on the heel bone's bottom, creating a spur. A heel spur can also be caused by wearing badly fitting footwear, which puts extra stress in that heel area. Symptoms of bone spurs are pain and tenderness, difficulty moving the joint, swelling in the surrounding tissue area, and formation of a lump in the affected area. In some cases, bone spurs can also cause numbness and tingling associated with nerve compression. So, chiropractors typically use various techniques to treat bone spurs, like adjustments, trigger point injections, stretching, massage therapy, deep tissue therapy. And with the adjustments, we're specifically adjusting the body to restore proper alignment and improve the range of motion. Trigger point injections target points to reduce pain and inflammation related to bone spurs. Stretching can help improve flexibility and reduce pain, while muscle work aids in relaxing muscles and improving flexibility and mobility. And when combined, these techniques can be very effective in treating bone spurs. Benefits of chiropractic treatments are that it reduces inflammation. Chiropractic improves joint flexibility and enhances range of motion. And also, patients can reduce their need for medications and surgery, which often have bad side effects or have very long recovery periods, like, for example, with surgery. Also, chiropractic is non-invasive, and you really don't have any of the risks of invasive surgery there. Your pain has a good chance of being reduced, and also chiropractic improves overall health and wellness and well-being. So chiropractic treatment can help realign the bones. They've been affected by the bone spurs, helping to reduce their impact on the movement or daily activities, and also that proper alignment of the bones can reduce the improper load bearing, which decreases the worsening of the bone spurs over time, keep them from getting a lot worse and creating even more problems. So if you have bone spurs, or you know somebody who does, check us out at newhopechiropractic.com. You can make an appointment right through our website, and we'll be happy to help you out. Again, that's newhopechiropractic.com. Have a healthy day.